Good morning. What a wonderful crowd. Thank you all so much for being with us here at Jennie Stuart Medical Center this morning. We're excited to have each and every one of you. If I could just ask our current board members to approach the front and sit up here. We're going to have just a few moments of acknowledgments, and we would love to have our board members come up front. I'd like to take just a moment. We've got a tremendous crowd. We're so appreciative of our employees and our medical staff who are here with us this morning. They're a great team of folks who are tremendously engaged in the care of our patients on a daily basis, and we appreciate your participation in this wonderful announcement this morning. I do want to take a moment. We have invited a number of individuals who have been critical and important to this hospital's success through the years. We have a tremendous current board of trustees, but we have volunteers in this community who have done wonderful things in service to Jennie Stuart Medical Center through the years, and they are with us this morning, and we appreciate their attendance at this wonderful event. So I'd like to take just a few minutes and acknowledge. And if you could just kind of raise your hand, we've got a big crowd here, but if you could just kind of raise your hand, do want to acknowledge some of our previous board members who were instrumental in setting the tone and the direction for the success of our hospital for 102 years in service to Western Kentucky. I believe we have Mr. Alan Beard here. We have Mr. Ray Cobb present this morning. I think Miss Teresa Nickel is in the audience. I don't know if Wilson Sisk was here, but we were expecting Wilson. Want to acknowledge him. I got a chance to speak to Mr. Wendell Lynch. He's here in the audience today. Mayor Dan Kemp is present. I don't know if Rich Leby, I know he had intended to be here, Mayor Rich Leby. Mr. Rick Scott, who is currently a Jennie Stuart employee but also a former board member, is present today. Mr. David Collins is present. Mr. Eston Glover, see him back there in the audience, got a chance to speak with him. Mr. Roger Jeffers is present with us today. And I don't know if she's here or not, but we had hopes that Jane McInnes could join us as well. And I would like to take a moment just to acknowledge the contributions in the past of these wonderful board members for Jennie Stuart Medical Center. If we could have our current board members stand up here and over here. We have our current chair of the Jennie Stuart Board, Kelly Workman, Mr. Earl Calhoun, our immediate past chair. We have Dr. Radala Gajera, who's the president of our medical staff and a current board member. Dr. Jenny Franke, who is a member of our medical staff and a current board member. We have Lori Harper present with us this morning, who's one of our board members and the chair of our finance committee. Mr. Tom Bell is present with us. Mr. Danny Francis. Mr. Tom Flynn. Mr. John Maddox, Mr. Derek Watson, Mayor Carter Hendricks is with us this morning, and never last and never least, but everybody knows Judge Steve Tribble. And these individuals, aside from attending the many board meetings and committee meetings we have each month, they invest a tremendous amount of their personal time and energy toward the success of Jennie Stuart Medical Center. And we want to acknowledge these people. We appreciate the effort that they make every day to make our hospital a success. Thank you all so much. Just a couple of other acknowledgments, please. I appreciate your attention. We'd like to acknowledge John Sumner, who's with us this morning. He is the CEO of Tree County Hospital, and he traveled all the way from Cadiz to come to our event this morning. I saw John earlier. I don't know, John, if you'll wave, but do appreciate John being here. He's a He's a good friend, he's a colleague, and we have a very good relationship with the other hospitals in our region, and we appreciate John being here for our event today. Thank you, John. And I'd also like to acknowledge just a few guests that we have from Nashville. QHR is the management company providing the CEO and the CFO for Jennie Stuart Medical Center, and we have our company president, Mickey Bilbrey, with us today. Mickey was here. There he is. Mickey Bilbrey's with us today, who's the president of our company. Mr. Bob Bento, who's the VP of Operations, is with us. Bill Donatelli, who's our East Division Vice President, and we have Jeff Hill, who is our Regional Vice President, with us today. And thank you, gentlemen, for being here. Beginning in 2013 and completing in the spring of 2014, Mr. Bilbrey assembled a team of consultants at QHR that began work with our administrative team, our board of trustees, and our medical staff to develop a comprehensive multi-year strategic plan for Jennie Stuart Medical Center. They worked with our board of trustees to assemble this plan, and it was completed in April of 2014. Since that time, our board has been engaged in the systematic implementation of this strategic plan. The number one imperative of Jennie Stuart Medical Center's strategic plan was that Jennie Stuart must continue its work in defining ourselves as the regional healthcare resource for the delivery of integrated care in Western Kentucky. Our key strategy within this imperative was to pursue a clinical affiliation strategy with a nationally recognized, best-in-class healthcare system. I'm pleased to announce this morning that after 18 months of intensive work with our board of trustees, key community members, members of our wonderful medical staff, and our administrative team, that our board's strategic affiliation committee has completed a 5-step disciplined decision process that has led us to this very important announcement today. And today, the purpose of this press conference is to announce our affiliation with Vanderbilt Health and Vanderbilt Medical Center. We have 3 key executives with Vanderbilt Health present today. You'll be hearing from Dr. Wright Pinson shortly. We also have Megan Pruce with Vanderbilt Health Affiliated Network and Vice President Jim Coram, who's there in the back. We appreciate your attendance today, and we're excited about our partnership today and in the years to come. We're pleased, honored, and excited to announce Jennie Stuart Health's affiliation with Vanderbilt Health through both a mutual cooperation and affiliation agreement and through membership in the Vanderbilt Health Affiliated Network. And we've got some folks that are going to spend some time talking about what this relationship means to us. And at this time, I would like to ask our chair of the Jennie Stuart Medical Center Board of Trustees, Ms. Kelly Workman, to come forward, and she's going to make some remarks.
Thank you, Eric. Wow, what a turnout. To say that this is an incredibly important day for our hospital and our community is an understatement, but, you know, let's just take it in. It's great. And I tried really hard to wear black and gold today, and I noticed that Dr. Pinson has a blend of blue and gold, so we're thinking similarly. But seriously, I appreciate all the hard work. Earl Calhoun's going to be speaking in a little bit, but he's played an integral role in the process. I also want to thank all the current trustees except for Dr. Gajera and Dr. Franke, all the board members are business people, right? So when you first land on the Jennie Stuart Board of Trustees, it's a little overwhelming, the importance and the magnitude of the hospital. I've not lived in Hopkinsville my entire life, but I was born in this hospital and I gave birth to my sons in this hospital. And I've never cared about it like I care about it now, because I realized how important, what a precious resource this hospital is in terms of taking care of the lives of the citizens, the quality of the physicians that we have, but the economic impact, all the employees and the family members of all these people. So it can be a little overwhelming. And if you could see the time that these trustees put into trying to educate themselves so that we can make the best decision long-term to keep the hospital healthy. And I appreciate Eric recognizing the prior board of trustee members, because, you know, we stand on the shoulders of those who came before us, and you all made such wise choices that handed us the baton with a financially very strong hospital. And you are kind of our role models for what we're trying to do, which is what brought us here today. Of course, this has been a tumultuous time in healthcare in many ways, and Earl, I'm sure we'll discuss this a little bit, but on March 23rd, 2010, President Barack Obama signed into law the Affordable Care Act. And with Kentucky Medicaid being perpetually re-engineered, sometimes governance can be a little tricky and it's hard to know what the right thing is. But Vanderbilt, in any measure, is the gold standard, and we are so blessed that they want us as much as we want them, so we're really, really excited about that. This is not Dr. Gajera's first rodeo in terms of being president of the medical staff, but I'm so grateful that he has been such a solid foundation for me so far this year. And gosh, Dr. Gajera, we're not even halfway through the year yet. So welcome everyone. Thank you for taking a little time out of your day to celebrate this special time with us. And now I'm going to turn it over to Dr. Gajera.
Thank you very much, Kelly. Good morning, everyone. I would like to welcome all our distinguished guests from Nashville and Vanderbilt. We really welcome you all. We, medical staff of Jennie Stuart Medical Centers, are very excited about this Jennie Stuart Medical Center and Vanderbilt affiliation. So, how this affiliation will change our patient care? At Jennie Stuart Medical Center, we have a very talented medical staff who have been taking care of patients for years in our community and will continue to deliver the same quality medical care at our hospital. Our obstetrician will continue to deliver babies. Our pediatrician will continue to take care of the babies. Our surgeon will continue to do the surgeries. Our family physicians, internists, hospitalists will continue to take care of all the patients with pneumonia and heart problem, diabetes, and all the sickness. Our orthopedic surgeon will continue to do surgery and replace the hip and knee. Our cancer center will continue to deliver the high quality cancer care to our patient and community. All the subspecialists will continue to do all the procedure, endoscopy, everything right here in our hometown. So, that thing not going to change. If any, it will get better. One thing will definitely change, and it will be for good, that this affiliation will help our patient to have easy access to the trusted and well-respected group of physicians and well-equipped state-of-the-art hospital for more complex and challenging tertiary medical care. This affiliation will facilitate and make it easy for our patient to new, more innovative therapy, clinical trials, and state-of-the-art new technology. We are really looking forward to work together with Vanderbilt physicians to enhance the medical care of our community. I know this is just the first step together for a new, mutually beneficial relationship. In this affiliation, I believe winner is our community. Winner are our patient. Not only they will continue to get quality medical care right here at our home, but we'll have access for a higher level of care just telephone call away. Yes, there will be challenges in this new path, but we are committed and we are willing to work together to find the solution for our problems. On behalf of all medical staff, I would like to thank Eric, Greg, Beth, and all the management team, and special thanks to our hospital board members. Their hard work, their vision, and their leadership to make this day possible for us. Thank you everyone again. I'm glad that you all here with us for this great event. Thank you. It is my pleasure to introduce our next speaker, Mr. Al Calhoun, who is our past chairman of the board, who has done tremendous work and spent hours and hours of time to make this thing happen. Mr. Calhoun.
First of all, thank you for being here. It's such a joy to see the people who are in the room and the number of people who are in the room. Almost 7 years ago, Kelly and Tom Bell and I started our tenure on the board just in time for the implementation of the Affordable Care Act, which we realized pretty quickly that health care would not be the same probably ever again in the future. We found out that you had to do actually more with less. You had to perform at a higher level because at some point your payments would be judged on quality. And that coincided with the board being ready to engage in the strategic planning process that's already been mentioned. And we realized, and if you follow the news any, you've realized as well that some things have happened since 2010 and the implementation of the Affordable Care Act. There have been some community hospitals that have not survived. There have been some community hospitals that have sold or merged into larger systems. And I commend our board on having the vision that a locally governed community hospital was critical not only to Hopkinsville, Christian County, but the surrounding region. So it then became a matter of, okay, how do we accomplish this? And the affiliation process is one that some of us heard probably our first detail about in a conference in Savannah, Georgia a few years ago. This was a QHR meeting, and everything began to click about that time about what made sense for this community region and this hospital. Kelly made mention of prior board members, and I also want to acknowledge that the financial position that this hospital was left in for us has been very important in these past 5 years. As I mentioned, there are hospitals that didn't survive. We've had a very sound financial base to work with and to weather the storm, which we have. From the quality end, this is not something that's very much known outside of these walls. But our quality scores in this hospital have gone from probably about average to the level that there is not likely a hospital in this region that can top the quality scores that Jennie Stuart is now showing. An unbelievable progress over the last few years, and I commend Beth McCraw and all of her staff. She diverts attention a lot, but it's all of that staff that has been responsible for raising that level of quality to an incredible level for us. So you can feel assured that the quality care is unsurpassed in this area. So all of that brings us to why we're here today. We studied and we researched and we interviewed a lot in the process of trying to identify an affiliation partner, one that was not interested in buying us. We saw the need to remain independent. Our affiliation partner at this point, we have seen them demonstrate that they have that same type of vision. Vanderbilt is not out here buying community hospitals. However, they are partnering through affiliation with many. When we met with them, and Dr. Pinson will speak in a minute, the level of interest by them, Dr. Pinson's personal involvement was just incredible. It surprised us. It pleasantly surprised us with the level, and their involvement through this process has been so encouraging when we look to what we try to accomplish down the road. Today, though, is just a kickoff of the beginning. This, in our mind, is not just a Hopkinsville Christian County initiative. In the same respect that Vanderbilt is bringing resources to Jennie Stuart that we could not do on their own, and doing it, by the way, in a world-class fashion, and world-class is used loosely sometime, but when you speak of Vanderbilt, you truly are talking about world-class. We want to take those resources and be able to help other communities and their operations remain independent, to support them in ways that we can so that their communities stay in control of health care in those communities. This is not just a one and done situation today. And the real test, in my mind, starts now as to what we jointly do with this opportunity to provide the very best and very broadest of health care for this entire region. My thanks to Dr. Pinson, the tremendous attention and support he's given us, to Jim Coram, who has been here at every request, plus I understand he kept interrupting a recent trip to Europe to call Eric just to check in and see how things were, to the point that Eric told him finally, stay on your vacation, quit calling me. And I would be remiss, although she isn't here, to mention Laura Beth Brown. Let me repeat that, Laura Beth Brown. She is a VP right under Dr. Pinson. Over the last 4 or 5 years, I've not only peppered her, probably pestered her with questions. She was responsible for 2 early meetings that we had with Vanderbilt, of which I know Jim was at one of those, our first introduction to Jim. I appreciate people such as her and Jim and Dr. Pinson who have a vision, who have a concern, who have an interest in healthcare that's outside of their walls. And with that, we'll always be grateful to you and your staff. Thank you all. Enjoyable day. Thank you.
One quick housekeeping item before we introduce our special guest. Mayor Bryan, I spoke to him this morning. We've actually got a meeting this afternoon, and I was jawing it up and joking around with him. Then I forgot to mention that he was one of our former board members that was here. And David Collins, did I acknowledge you earlier, David? Okay, I was sitting there thinking, I thought, okay, so I forgot Wally. I was like teasing around with David earlier, and I got to make sure I acknowledge David as well. So apologize for that. It always happens, but Wally, you're always someone who understands, so appreciate that. At this time, I would like to ask Dr. Wright Pinson to come forward and say a few words on behalf of Vanderbilt Health.
Good morning. Good morning. So I want to say to this august board, I want to say to the members of the QHR team, I want to say to the medical staff, I want to say to the management team and all the employees of Jennie Stuart Medical Center, I am delighted to be here. We started our initial conversations a few years ago in response to the environmental changes that have been outlined. We recognize that where healthcare is going in the future, if we are going to serve our patients and serve our communities optimally, we cannot do that alone. We have to develop systems of care over broad geographic areas in order to meet the demands that are going to be upon us in the future. So it's exciting to be standing here today, because today is about two institutions that are coming together in ways to further benefit all those that we serve, our patients and our families. So I want to add, importantly, I want to give my greetings and welcome to everybody here who is a member of this community. This is all about you. It is a day that marks a milestone between our organizations. According to the mission statement for the Jennie Stuart Medical Center, it exists to promote, to preserve, and to accommodate the growing healthcare needs of this community. The Vanderbilt mission is to improve the lives of individuals and communities through teaching, education, and research. So you can see that we have the same values and we have the same goals. So from this day forward, we will work together to help expand the scope of healthcare services and growing healthcare needs of people who call Hopkinsville and the surrounding areas their home. We recognize at Vanderbilt that we have capabilities and skills and services that are valuable. But we recognize that Jennie Stuart has exactly the same. We recognize that we are much better as a partnership in serving the members of this community than we are individually trying to do our part alone. We believe that healthy communities are thriving communities. And we take pride in forming relationships with clinicians, with employers, and patients to deliver health care that invests in the long-term health while sustaining and delivering sustainable cost control. I do want to thank the foresight and leadership of your medical center leaders. Jennie Stuart is no longer a standalone medical center. Jennie Stuart is now part of a 48 hospital and 11 health system strong network called the Vanderbilt Health Affiliated Network. And network membership means Jennie Stuart leaders can collaborate with Vanderbilt and other member institutions to further strengthen care coordination, including health and wellness activities, drive clinical and quality improvements, which, as has been stated, is already at a very high bar here, use technology and share data in new ways, reimagine healthcare, provider reimbursement, and finally, work together towards a vision of better healthcare while benefiting from shared knowledge and resources throughout this network. We know that healthcare is changing. We can either kick the dirt, wring our hands, whine, and cry, or we can get a vision, develop relationships, meet the challenges, hold our heads high, and be proud of the health care that we can deliver now and in the future. Our patients and their families demand and deserve this. They deserve high quality, low cost, and convenient health care. This strategic affiliation between our two organizations provides a structure for creating that more efficient, cost-effective patient care through new programs and services. It also allows the ability to form shared clinical services and programs that respond to community needs here, such as initially cardiovascular services, including cardiology services, cancer services, and the development of walk-in clinic services, as well as telemedicine. I'm delighted to be here with some of my former colleagues, Jenny Franke, Rotilla Gajera. I've worked with them for 25 years. So reinitiating these professional relationships at a new level is a wonderful thing for me. In fact, I'm delighted to see so many familiar faces here. In closing, let me share that I admire Jennie Von Stewart and her husband, Dr. Edward Stewart, for their legacy and dedication to health care and well-being of this community just over 100 years ago. It is a wonderful legacy. Could not be prouder to be a small part of continuing that legacy. Vanderbilt University Medical Center and the Vanderbilt Health Affiliated Network are honored to work with the Jennie Stuart leadership to keep that tradition going forward. Thank you very much.
Thank you all for your attendance today. One more brief acknowledgement. We want to acknowledge our media partners who are here today. We have robust representation from our local media outlets in the region, and without you and your interest in what's happening in healthcare in our region, this event today would really not have the weight and the importance that it does. So we really appreciate our media partners being so diligent in participating in this event with us today, and thanks to each and every one of you who are represented here today. Thanks again to our employees and our medical staff and all of our community folks who are here with us today. We have a number of our board members and our guests who have critical time commitments, so we are going to have our administrative team present at the conclusion of this press announcement, available out front. We know there's probably some follow-up questions that our media partners want to ask, so we'll have our administrative team present for that. Please, if you have not had an opportunity to have breakfast, take some time to eat at the conclusion of this. And again, thank you all for your attendance today. We appreciate it very much. We're very excited about our future moving forward, and we'll have information to come to the community as we work on a number of very critical initiatives with Vanderbilt Health. Thank you all again very much.